Hello and welcome to this episode of Rigicon Talks. Today we're focusing on the nurse's vital role in prosthetic urology surgeries and the patient journey. With us today is Belinda Bradfield, an experienced nurse who has been involved in prosthetic urology surgeries and working with the Rigicon Australia team. She'll share her perspective on patient care and how nurses help patients navigate during and after surgery. Thank you for joining us today, Belinda. Belinda, can you start by explaining your role as a nurse in prosthetic urology surgical process? What are your key responsibilities before, during, and after surgery? And how do you help prepare patients for the procedure?
Yeah, no worries. So my role is really about patient education and ensuring that the patients are fully informed and aware of what to expect before, during, and after the procedure. I really try and bridge that gap between the prosthetic urologist and that patient, where there often tends to be that gap. So before the procedures, I touch base with the patients and go through a pre-op screening. I also then answer any questions that they might have about the procedure, the aftercare, or the prosthesis itself. During the procedure, I'm just mainly there to help answer any questions, or especially in that first 3 days, if they run into any problems or they're unsure about their medications, I'm really just an extra support person for them. And then in the 6 weeks following the procedure, again, I'm just another person that they can ring if they're unsure about anything. I also help guide them through what our expectations are for them during that 6-week period. And then when we go to either activate or cycle the prosthesis, I'm either the one that does it, or I'm there to help the prosthetic urologist. And then I'm there in the aftercare for the next couple of weeks if the patient runs into any problems or concerns.
Thank you. That's perfect. Let's move on to our other question. So, many patients may have concerns or anxieties about going under a surgery. From your experience, how do you help patients manage these expectations?
Yeah, so I like to just reassure patients that it's very normal to have some anxiety and concerns about going into any procedure or operation. So that's the first thing, is just to reassure them that it's normal what they're feeling. And then I just try and dissipate as many concerns or anxieties as I can for them. So this is very much patient dependent. So whatever questions or worries they have, I talk them through those. And then if there's anything that I can't answer for them, then I can either get an answer from the surgeon for them, or I link them back to the urologist to have a chat to them again before proceeding with the surgery.
That's great. Thank you. So on to our next question. Recovery is a crucial part of the surgery process. What does the typical recovery look like from your perspective, and how important is patient compliance with post-surgical care? What are some common challenges you see in this phase?
Yeah, so patient compliance in recovery is vital. I always say to patients when I'm doing their pre-op that we can do as much as we can during the surgery to ensure that the prosthesis is put in correctly and is working. But after the surgery, it is really all down to the patient and their compliance with the recovery. So the initial recovery period, I stress to patients, is really that first 2 weeks after the operation. They really need to rest as much as possible. And after that first initial 7 days, that's when their education and their role comes into play with what I need them to do with the prosthesis. And I'm there to help support them and educate them further if they need it. But at the end of the day, the patients are the ones that need to be compliant in their post-recovery care and put the work in for those 6 weeks. A lot of the challenges that I see that patients talk to me about, or I get phone calls about, is rest. How much rest do they need? Are they, simple things like, are they able to still walk around the house or out to the letterbox, or can they get in the car and drive to the shops? So answering all those types of questions for them. And then it's generally with when they go to cycle or activate the prosthesis, then they often have some questions around how to use it and things like that I'm able to help with.
Thank you so much. That was perfect. So on to our next question. Nurses and surgeons work closely together to ensure successful outcomes. Can you talk about how this teamwork impacts patient care and overall outcomes in prosthetic surgeries?
Yeah, no worries. So it's vital that the prosthetic urologist and the prosthetic nurse are on the same page and working together. And it's the best way for the patient to get the best outcome possible. It gives the patient two different people that they can access to get information and education from. And as long as we're on the same page, we're going to be giving the patient the same advice, and then we're going to be able to help them through their journey so they get the best possible outcome.
Okay, thank you so much. Let's move on to our next question, which is, for patients who are considering an implant, what advice would you give them based on your experience working closely with both patients and surgeons?
Yeah, my best advice would be to go in with your list of questions to the prosthetic urologist and get them answered pretty much. Just anything that you think of or that you're worried about or concerned about. It's not going to be anything that the prosthetic urologist hasn't heard before. And they're the ones that can give you the best information. And then they can make an informed decision about whether this procedure is the right one for them.
Belinda, for sharing your valuable insights today. It is clear that nurses like you are vital in supporting patients through their prosthetic urology surgery journeys. Thank you, and thank you to our audience for joining us today for this episode of Rigicon Talks. We hope today's discussion has been informative and helpful. Until next time, stay informed and take care.
Okay. Thank you.